Hello, I'm Fiona. In this presentation, I will answer this inquiry question. Why is occupational participation important for people diagnosed with dementia? Occupational therapy as key partner in dementia care in Seychelles. At the end of this presentation, you would have learned more on the discovery and history of dementia, the effect of dementia on a person and on carer, Seychelles and the history of occupational therapy, dementia care and what influences the practice, concluding with what should we be doing and what have I learned. Discovery and history of dementia. Dementia was first discovered by a German psychiatrist and neurologist Dr. Alois Alzheimer's in the 1901, which was later confirmed through a postmortem in 1906. However, according to WHO 2012, it is considered as one of the most undiagnosed conditions worldwide. Being underdiagnosed means that people affected by dementia are not receiving proper care. In the 20th century, most clients diagnosed with dementia were cared for either in mental home or asylums in the United States, according to 2015. This could be due to lack of research during those times to better understand people with dementia. However, as the world started to understand this diagnosis better, this has changed gradually as these patients are now being cared for either in nursing home or in their own home, as stated by INES 2002, who concluded that dementia care is going through transition. Effects of dementia on a person and on their carers. A person diagnosed with dementia is affected in different ways, and different types of dementia have different effects on the brain, although the symptoms they cause may be similar. Most commonly, people with dementia will gradually lose their ability to think clearly, remember things, especially recent events or conversations, will be unable to reason effectively, and will sometimes behave in ways they are not appropriate. The rate at which this happens varies greatly and is very much an individual experience. People with dementia gradually lose their ability to solve problems, may get lost in familiar surroundings, show poor judgment, decision-making, have poor emotional control, and respond to situations in a slow, unsure, and confused manner. They can also exhibit difficult behaviors such as agitation, repetitive actions, and questions. Carers caring for people with dementia are also affected as they try to cope with their loved ones, as well as try to understand the behavioral and physical changes. As a result, this may put pressure on family relationships and friendships. Seychelles and the history of occupational therapy. Seychelles is a group of islands located in the Indian Ocean. The government, through its Ministry of Health, is mandated to ensure that the population of Seychelles receives the highest level of health care and well-being through the provision of effective services it offers for its population. The elderly population has increased over the last 4 years here in Seychelles and as shown in the table. However, after viewing the Ministry of Health annual statistics bulletin, I noticed there was no demographic information about dementia, although I am aware that at times the term dementia is used to describe the behavior of some of our patients and clients. The Occupational Therapy Unit falls under the Rehabilitation Services Directorate of the Healthcare Agency of the Ministry of Health. Occupational therapy was first introduced in the 1970s by the American Peace Corps organization. The first occupational therapist on record was an American Peace Corps volunteer, Mrs. Kemp, who worked at the Lake Psychiatric Hospital in the early 1970s. I know this from a retired occupational therapy assistant, Mrs. Niken. Looking at the client's occupation and occupational performance was very important in the early days of the profession. Various forms of occupation was used, such as activities of daily living, gardening, crafts, sewing, and carpentry. It was in the early 1980s that occupational therapy was introduced at the Fines Institute, which was the government elderly residential home. During those times, therapists from other countries, such as India and Sweden, had come over to Seychelles to further develop the profession. More people were trained as occupational therapists. Assistants. Similar type of occupation was introduced at the Fins Institute, such as carpentry, craft, and personal activities of daily living. In 1970 and 1980, most occupational therapy intervention for people with cognitive impairment, including dementia, was through engaging them in various occupations at the Lake Psychiatric Hospital and the Fines Institute. Since 1990, with increase of more occupational therapy staff, we started to work with people with dementia on the hospital wards, elderly homes, and rehabilitation hospitals. These are similar settings where occupational therapists in Australia offer their intervention with people with dementia. Bennett, Shen, and Little, 2011. In the year 1990, the type of occupation varied again as the staff tried to engage those clients in other activities such as Renaissance, whereby they got to revisit their pastoral albums or past photos, and as well as visiting familiar places which were important to that generation. These cognitive group activities were seen as important for these clients as it allowed them to engage in familiar conversations. It was only in the year 2005 that community occupational therapy was introduced, and hence then we could intervene in the person's home, reducing admission at the Elderly Fines Institute or the Lake Psychiatric Hospital. Hence we had to look at turning their home into a dementia-friendly environment. Why occupation? What is its importance to humans? The type of occupation selected during those times was seen as having value to those clans. For some of them, these occupations were during their working years their means of earning a living, example carpentry. Hence, in other words, it had value to them and it focused on something that they knew cognitively. It is important for occupational therapy to look at the patient's occupational interests and participation, in addition to show the importance of occupation in helping people achieve health and well-being. According to the model of human occupation developed by Gary Kiel-Hofner in the United States in 1995, the environment influences occupational behavior and provides opportunities for performances. It also asserts that we all have evolution to act that is expressed in our occupational behavior. In my practice, environment is a very important aspect as it is the setting in which occupation will take place. In other words, the environment needs to allow the person with dementia to perform their occupation with interest. Our knowledge of evolution as defined by Kiel-Hofner 1995 helps us to better plan dementia care for our clients, whereby evolution depicts the client's relationship with his or her environment. Hence, if the environment is not dementia friendly, the client will not relate to it and hence will not participate in occupation. It is believed that through doing and participating in occupation that people with dementia find meaning in their lives, according to Fanny et al. 2007, as stated in Morgan Brown et al. 2011. Furthermore, Perrin 2000 previously stated that being active is a powerful human drive and its absence has a negative impact on one's well-being. Morgan Brown et al. 2011. In other words, this is saying that we should encourage people with dementia to continue to participate in occupation so that he or she will feel a sense of well-being. In addition, it is important to focus on activities that are familiar and were enjoyed when the person was healthy. Learning new things can be very hard for a person with dementia, so routine, familiarity, structure, and minimizing change become increasingly important and should be taken into consideration. Dementia care and approaches to practice. Dementia care mapping and person-centered developed by Professor Kit Wood more than 20 years ago also takes the standpoint of a person with dementia. This approach seems to have influenced the way occupational therapy works with people with dementia worldwide. The work of Professor Kit Wood helps to understand a person as center of our intervention, as stated in G. and Scott Milton in 2014. Kit Wood's person-centered approach values people with dementia and those who care for them, treats people with dementia as individuals, and takes an individual approach to assessing and meeting their needs, looks at the world from the perspective of the person living with dementia, recognizes the importance of relationship and interaction with other people and their potential to promote well-being. They also encourage care workers to provide a holistic approach in their care for people with dementia, drawing from the model of human occupation and person-centered approach, G. and Scott Milton in 2014. Knowledge on how to care for people with dementia is paramount, concluded in research done by Twat and Steele 2011 in South Africa, in a study to assess dementia care mapping in an institution in that country. Hence, this supports the effectiveness of dementia care mapping, as it allows us to observe the person in his or her environment, which would definitely take into consideration of one's unique culture and local context, plus the need to educate carers. Since she graduated in 1999, Grace O'Sullivan is an occupational therapy that has focused her work on the importance of occupation, occupational participation, and occupational performance of people living with dementia. Her belief that people should engage in occupation is important to us occupational therapists. Using Law et al. 1996 PEO model helps us to better understand a person with dementia, as it helps us to consider the person themselves, the environment, and their occupation. Furthermore, recent research shows that our intervention looks beyond occupation, beyond that person and his and her environment, but how all three entwine with each other to facilitate occupational performance and occupational participation. Two different research done in Australia 2011 by Bennett, Shan and Liddle, and in Ireland 2014 by Margaret and O'Callaghan showed that the environment modification, prescribing adaptive aids, and teaching strategies for basic personal activities of daily living are key intervention areas that occupational therapy focuses on when working with people with dementia. It facilitates the link between person, environment, and occupation. Influences on practice. World Health Organization stated on their website 11 April 2012 that worldwide nearly 35.6 million people live with dementia. This, they stated, is expected to double by 2030. Dementia, a public health priority report published by the World Health Organization 2012 and Alzheimer's Disease International, recommends that programs focus on the improving early diagnosis, raising public awareness about the disease, providing better care and more support to caregivers. According to WHO 2012, only 8 countries worldwide currently have national programs in place to address dementia. Seychelles, being a WHO member, does not have a specific program for people with dementia, and as affirmed in the report, dementia is underdiagnosed here in Seychelles. Hence, a lot needs to be done to increase awareness of the condition. Hence, this is an opportunity for us, occupational therapy, to play a key role with other professionals to advocate for the need for better service for people with dementia and their carers, with WHO as support. Note that countries such as United Kingdom have the government committee to ensure that there are supports in place to improve the care of people with dementia and their carers, Alzheimer's Society 2011. In 2009, Seychelles signed the United Nations Education, Science, Culture Organization Convention for the Rights for People with Disability, and hence puts some pressure whereby the government has to show its commitment in improving its services for people with disability. That includes people diagnosed with dementia. However, so far, what has been done has been in terms of physical adaptivity, such as building ramps and encouraging importation of adaptive aids, which occupational therapy has been involved with. Issues specific to dementia care has not yet been taken into consideration. What should we be doing? What have I learned? Well, I strongly believe that occupational therapists have the knowledge on the importance of occupational health and well-being and its negative impact on health when it is absent. Our ability to treat people as unique individuals through a patient-centered approach, and our ability to look beyond occupation and look at the person's environment and also at aids to facilitate the doing of occupation makes us a key partner in dementia care. This table shows the statistics of clients and patients above 60 plus of different diagnoses referred to occupational therapy over the last 3 years here in Seychelles. The data shows that, for instance, in 2014, 30% of clients and patients seen by occupational therapy were what we consider the age of elderly. This therefore shows we can play a key role in educating them and relatives about dementia. Occupational therapy can be a key partner in dementia care through different strategies. To begin with, I need to advocate for the need for proper assessment of people with cognitive impairments such as dementia by discussing with the management of Ministry of Health. Having read about the universal use of dementia care mapping, I am convinced it can help us to further improve the care of our clients and patients, which would take into account our culture and local context. Hence, I would like to propose this approach to my colleagues using this presentation as a guiding tool. As an occupational therapist, I should further advocate for use of occupation to achieve health and well-being in partnership with other professionals. To encourage occupational participation, I will support the setting up of a support group for persons diagnosed with dementia as well as their carers and relatives. I would encourage production of information leaflets to inform carers, relatives on adaptivity and tips for living with people with dementia. Research has shown if carers are educated, this would encourage people with dementia to be able to continue to participate in their occupation. In addition, together with the multidisciplinary team, produce information sheet and place on the Seychelles Occupational Therapy Association website as well as the Ministry of Health intranet website as seen on the Canadian and American Occupational Therapist website as part of continuous education. To conclude, through this assignment, I have learned a lot about dementia care as well as revisited the philosophy of occupational therapy and its use of occupation in relation to achieving health and well-being. Through my search, I have been able to compare our practice in Seychelles with the rest of the world and realize that we are up to date in terms of use of occupation, looking at the person uniquely and adapting his or her environment. However, what is missing is proper diagnosis so that a more effective multidisciplinary care approach can take place. I have also noted that we need to be realistic and provide effective intervention that truly considers what the person can do, wants to do, and will do. Lastly, there is a need to write about the history of occupational therapy, its development for future references. Thank you.